We got time for one more quick question, and then we have to get from road staff. Will be staying behind if you have anything you need from the office.
Well, this isn't a question as much as a comment. You know, your phone call said I'd like to know what your concerns are about what's going on in Washington D.C. and that's what brought me here because I have a lot of concerns. I'm just getting ready to retire, and I think I'm going to spend my whole retirement worrying about what's going on in Washington D.C. instead of enjoying myself because things are not going well. But I wanted to address what you were just saying about, in general, the Affordable Care Act, but a broader perspective on, the medical system. First of all, I wish people would separate the terms health care from insurance because, good health care does not depend on the insurance. They're two separate issues. And what we're fighting about right now is insurance, through the Affordable Care Act. I'm a physical therapist. I graduated 4 years after Medicare came in 1966. I started in 1970, and so I've been a therapist for about 42 years, full-time most of that time. I dropped out of the system 2 or 3 years ago, and I do a different type of work now, but because of what was happening. But I just want to give a perspective. When I first graduated, Medicare was brand new, and we were still working under the old system of healthcare. You could give quality healthcare, and the decisions were made by the doctor, who would come to the therapist and say, is this patient ready to go home, blah, blah, blah. It was old-fashioned, but we could spend time with people. We could determine how much time a person needed. Over these 42 years, what I've seen, once Medicare started to grow, everything became managed by the federal government. What we could do, how much care we could give, when we could give it, to whom we could give it. The ability of us to provide care became smaller and smaller and smaller and smaller. And I could give you endless examples of this. So the healthcare system was very, very good and still is very good, but it is managed by the federal government. The federal government should not be involved with either the insurance company, that should be a free market system, or with the healthcare system. I feel that very strongly. I've seen, if you have a broken hip, your therapist can only give you the amount of care that Medicare says you can have based on the fact that you have a broken hip and you broke it, at what age you broke it. And that was 5 years ago before I dropped out. It's worse. It's much worse now. I just feel that the broader perspective is that the federal government is involved way too strongly in our healthcare system via our insurance system. And it's not a good thing. That's why I'm absolutely against the Affordable Care Act. They shouldn't even be there. It's a wrong system. And I came here to express to you that I represent people in your district, even though we are a blue state, who disagree with what's going on in Washington. What I came here to talk about really was the budget, because the budget is so out of control. We should have a budget. That's the other thing. We should have a budget. Constitutionally, we should have a budget.
And the Senate passed a budget, and the House passed a
When?
budget. The Senate
Not
passed.
for 4 years.
No, that's not true.
There has not been a budget
There's not
in
been a budget
place
for
under
4 years.
Obama. A signed budget hasn't been in place under Obama.
Can I, this is an important factual issue. The Senate passed a budget in March or April, and so did the House. Both the Senate and the House. Now, the Senate had not passed one for a long time, you're right. The House has been passing, the Senate had not. Both bodies did pass them. We've been waiting since April for a conference committee.
Yeah, we don't have a budget yet.
Right, but that was a decision by leadership in the House not to appoint conferees. And that is what is now happening as part of the end of the shutdown, was that conferees were named last week, or 10 days ago, and they've begun meeting, and they are supposed to be presenting a proposal for a joint budget.
Okay, but that doesn't,
December 13th.
that doesn't resolve the issue. We've been functioning extra constitutionally without a budget, at least since Obama came in. Whatever the reasons are, the government isn't doing its job the way that it's supposed to be doing
I
it.
hear you on that. And
I haven't heard you speaking up about that at all. As a matter of fact, I haven't heard anything from you. And I keep track of, I listen to the news.
I'd be happy.
I
I have supported a different budget that I thought was more responsible than what passed in the House. I've been on the floor multiple times in the House of Representatives calling for a conference committee, calling for a formal budget. I was on the budget committee in the town council in Cheshire. I'm a big believer in budgets. My dad ran a company. I work with small business all the time. Absolutely, budgets are functional priorities, and we should have a budget. And I've been strongly advocating that, and I can you know, if it would make you feel better, I can provide you a list of every time I've raised that in writing or on the floor. Now, I'm one of 435 members.
I understand that.
So, and, you know, and the issue, I would just say also, having worked on healthcare issues for a long time and being the designated family member to deal with insurance companies and having had physical therapy for surgeries, what you're talking about is exactly what I've dealt with for myself and family members, being told by the insurance companies, you have no more than 10 visits, you can only see this therapist, not that therapist, and that's working with a private insurance company. Those same issues are exactly, I mean, that's happening all over in the United States.
Right,
And
but-
it is no, Medicare is no different in that regard than
Everybody
private.
follows Medicare guidelines, and the federal government is telling the insurance companies what they can and can't do. I don't need insurance for pregnancy. I'm probably not going to get pregnant. But I have to have it because the federal government said, that's one example. My husband and I don't need insurance for mental health issues. There should be insurance for what you need, and now that no longer exists. And that's why insurance costs are going up, because we're all paying for everything. It makes no sense. The federal government doesn't belong in an insurance
Well,
company.
I hear what you're saying, and
And I'm very sorry to interrupt, but the Y has graciously allowed us this hour here, and so we do really need to wrap up now.